Thank, thank you. Thank you. Welcome, everybody. Welcome to the Senate Democratic Caucus meeting. I'm Allison Clarkson. I have the honor of being the majority leader of this great caucus. And we have been every other week trying to get sort of statewide picture of issues and institutions that have big impact around the state that many of us, many of our committees will touch on. And so it's wonderful for us today to be hearing from the Vermont State College system. Today, we are lucky enough to have Sophie Zadatny and her wonderful Director of External and Government Affairs, Catherine Levasseur. Sophie was the General Counsel of the Vermont State College system for 3 years before she was made the Chancellor and before she was appointed Chancellor in 2020. And she stepped into this important role at a really pivotal moment for our state colleges. And we so appreciate her dedication to our students in Vermont. And of course, we welcome back Catherine Levasseur, who's no stranger to this building and to our work, as she assisted our speaker for many years and worked in the State House for years before that. And we treasure her, and it's good to have her back. So Sophie and Catherine, welcome. It's wonderful to have you. The floor is yours.
Well, thank you. Thank you so much. We really, really appreciate it. We thought we would sort of provide a quick overview on transformation, which is obviously the big thing that we're working on right now, and then some information about the critical occupations and other scholarships that the state provided to us, which we're very, very appreciative for, and many of our students benefited from. But I know our time is limited, so I would encourage, if anyone has any questions as we go through this, please feel free to ask them, because we really want to share, answer your questions, give you the information that you want, rather than just giving you, a sort of set script here in terms of what we're doing. But with that, I just want to make sure that you're aware of what we're up to. We have really benefited from your support, and we're very, very appreciative of the support the state's given us. So right now we are 4 institutions: the Community College of Vermont, Castleton University, Northern Vermont University, and Vermont Technical College. And right now we're working, with the state to completely overhaul our system. And we've been guided in that work by the Select Committee on the Future of Public Higher Education in Vermont, which was a legislatively created committee back in 2020. They issued their reports December of 20, and then February and April of 21. Our board adopted the recommendations, the main recommendations coming out of that Select Committee work, and that's the path that we've been on since then. So we really are committed to our Vermont students and keeping public higher education accessible in the rural communities of the state. And also we're obviously working to eliminate our structural deficit with state support over the next 4 years. So just a quick reminder, we are one of the largest regional employers in our host communities and across the state. We employ nearly 3,000 people in Vermont. A cornerstone of our system transformation is our commitment to our rural campuses as educational and student support centers. So we currently have main residential campuses in Castleton, Linden, Johnson, Randolph, and Williston. Additionally, the Community College of Vermont has 12 locations across the state. Vermont Technical College, its nursing program is located in 15 communities statewide and in New Hampshire's border communities. And then all of our institutions also offer robust online learnings. With that, as I mentioned, we're going through the transformation. One of the main goals of transformation is to bring together Castleton University, Vermont Technical College, and Northern Vermont University into one new university that will be called Vermont State University. And we're looking to launch the new university in July of 2023. So at that point, we will be 2 institutions within the Vermont State College system. As you can see in the middle of this slide, there are a number of functions that we're looking at combining across. That was the other big recommendation that came out of the Select Committee, was consolidation of administrative functions. So we already have a number of those that we have already implemented, some pandemic and pre this transformation work, some that we're doing right now. For example, we're moving forward with a single library system for across the system. And so some of those things that are in the center there that you can see. So for example, workforce development, we are looking to highlight workforce development as we move forward with our transformation, so that right now we do a lot of workforce development, particularly Community College of Vermont and Vermont Technical College, but also at the other two, at Castleton and at Northern Vermont University. And we really want to unify and bring those workforce development functions so there's a single point of entry with no wrong door for employers and students, and really building on the strength of the current programs that we have. So that is a key part of the transformation as well. We're also looking to create a truly hybrid university, providing a high quality education across all of our campuses and the state, regardless of where a student is located. So some people, they're not quite sure what hybrid university means. So it means a combination of both being in person, but also being able to access programs and student support services virtually as well. So really looking to create a good functioning system, consistent policies and things across the system, but really trying to reach students where they're at. The other piece that we're really working on here is making sure that, let me just skim ahead here, is making sure that you're aware of all the work that we've been doing on transformation. We did adopt a professional project management approach for our work, which is something that was highlighted in the Select Committee report. So far, as you can see on this slide, we have 4 core teams that are working right now on transformation. We have many students, we have many faculty and staff working on transformation teams. We also have a student advisory council that's working with us on transformation. So far this year, we've established a unified system-wide budget. We've accomplished the first step of our structural deficit reduction for FY23. We've made tremendous progress on overhauling our academic program array in collaboration with our faculty to combine over 250 programs into about 100 higher quality, career-ready and relevant options. We've determined the mission and vision for the new university, and we've already launched the search for the new president, the first president of Vermont State University. So right now we have over 150 faculty, staff, and administrators working on those 4 core teams, with more of them being added to do project-specific tasks. We had 87 faculty members working on the program array last summer for the new university. That work has continued on through this academic year. We have also had about a dozen faculty leaders working on the faculty governance structure for the new university. We also have an advisory council of students. We have about 30 students on that council. We meet with them and sort of explore with them some of the work we're doing and get their feedback to help inform the transformation work that we're doing. So there's a huge amount of work going on within the Vermont State Colleges on this. Enrollment is strong this year. We're not back to our pre-pandemic levels, but we are stronger on our enrollment numbers than we had projected. For our budget for this year. We welcomed over 10,550 students back to our campuses in the fall. All 3 of our residential students have experienced a drop in enrollment for returning students, the total number. And part of that is because we had smaller incoming classes in the fall of 2020 and larger classes leaving us. So that's just one of those things we have to live with as we move forward. The Community College of Vermont's new student course placement was up significantly this fall, and they've been very positively impacted by the 802 Opportunity Scholarship with VSAC and also the Workforce 2.0 program that the state supported. Many of our students have been adversely impacted by the pandemic. Many of them are economically vulnerable. They face housing and food insecurity. We've also still dealing with the fallout from the uncertainty about the long-term viability of our campuses based on the announcement that came out 2 years ago. So we've been working to overcome that, but it has been a challenge for us, certainly in particular at Northern Vermont University, to overcome that negative narrative. Beyond that, we always like to just remind you our students are not, are special. They have come from very interesting and different backgrounds. So 82% of our students are Vermonters. A third of our students are first-generation college students. A third of our students meet the income thresholds to qualify for federal Pell Grants. And more than a third of our students can be described as non-traditional. And by that, we mean they have one or more characteristics that make them different from what you would think of as a traditional college student. So for example, they're 25 or older, they're financially independent, they may have children or families, they work full-time jobs, they're commuters, they may be studying part-time. So a lot of the issues that are impacting the rest of the state, housing costs, the COVID-related challenges with schools and childcare, the cost of childcare, rising food costs, all those things, broadband access, those all have a huge impact on our students. So as we move forward, we really appreciate any support and continued reassurances that the state can provide to us as we go through this transformation. So again, on this slide, you can see our student enrollment or headcount by full and part-time attendees. We did group together the numbers for Castleton, NVU, and Vermont Tech, as they will be the three institutions that are coming together. So this was information that some of the information we've been required to provide to the legislature as part of the Act 74 last year. We also have information on the full-time equivalent enrollment for students by institution. To be full-time, that's taking 12 to 18 credits a semester. And so as you can see, as we have a large volume of part-time students, our full-time equivalent is always lower than our headcount. The other piece we have is the degrees and credentials of value that have been awarded. So that's the information on this particular slide. So in 2020-2021 academic year, we did graduate over 2,000 individuals into the workforce with a degree or a certificate. And again, we have more than 2/3 of our graduates living and working in Vermont. So I'm going to turn it over to Catherine to share some information on the scholarship programs. But I'm also, again, happy to take any questions if anyone has any before we do that.
Right. Does anyone have a question at this point, or do we want to wait till the end? Or there may be some questions right now. Anyone with a question at the moment, or should we finish?
Looks like we're finishing. All right, Catherine, thank you so much.
Let's keep going. It's great. This is just this is just what we wanted. This is great.
Perfect.
Well, I'll talk next about some of the state-funded scholarships and workforce development initiatives. And I'll start with in Act 9 of 2021, there was a long-term care facility practical nursing program that was funded in partnership with us, Vermont Technical College, and the Vermont Association of Hospitals and Health Systems. So this is kind of a new model for our nursing programs, and it opened up 40 seats in long-term care facilities, in 5 different long-term care facilities around the state, to students so it's open to current employees to upskill into a practical nursing certificate, which puts them on the path for LPN licensure. And so what is happening with this program is the students are currently completing prerequisites and applying into the program, and then they'll start their practical nursing courses in the fall. And so again, this is a little bit of a different model for us. It brings our nursing program into the long-term care facilities, but this is a model that if this program goes well, we think that there is tremendous opportunity for expansion and to even expand it potentially into our associate's degrees, which lead to RN licensure for nurses in future years. And so we're really looking forward to seeing how this shakes out over the next year for us and for our students. The next initiative that was funded that I'll talk briefly about is the Workforce Upskilling Initiative. So you may remember that in fall 2020, the state funded a CRF workforce initiative to provide up to 2 free classes to Vermonters who were impacted by the pandemic. And in Act 9, this was funded a second time, so for this academic year. And this year we placed 1,148 students in over 2,000 courses. And I'll just remind you that in fall 2020, we served over 971 Vermonters with just under 1,400 courses. And so in total, we have over 2,000 Vermonters who were impacted by the pandemic, who were able to upskill because of these programs. And we do have a third workforce initiative that the state funded in the budget last year, and we're going to be launching that for next academic year. So we'll launch that over the summer for 22-23. The state also funded a critical occupation scholarship, and you've probably heard a lot about this one because this was the last dollar tuition program pilot, and this provided last dollar tuition. So that is after state and federal gift aid. So that's after the Pell Grant, the Vermont Grant, any federal or state scholarships. We applied it after institutional aid as well. So it was truly a last dollar program, meaning that this is the money that students were going to pay out of pocket or take out in loans. And so we provided that in a scholarship to students in certain programs selected by the state. And so those programs included all of our nursing and nursing pathway programs, our early childhood education programs, and we offer certificate through bachelor's degree in early childhood education. We offer certificate through master's degree in nursing. We did paramedicine, radiologic science, respiratory therapy, dental hygiene, and then we also did the programs that are defined as best bets for a good paying job within 18 months by the McClure Foundation. And this program was tremendously successful with both new and returning students. We had over 1,000 Vermonters who accepted the Critical Occupation Scholarship. And you can see here the median age was 28 years old. The median family adjusted gross income was $67,000 for the entire family. And 85% of those scholarship recipients identified as women. And I'll just show you here, this shows the enrollment in some of the programs that received the Critical Occupation Scholarship. So we focused on this slide on the early childhood education and the nursing programs. And you can see some really big jumps here. A couple in particular that I'll draw your attention to. The Vermont Tech bachelor's program takes a student from their associate's degree to the bachelor's in nursing. And that program nearly doubled enrollment from 52 students to 94 students this year. All of Vermont Tech's nursing locations, so you might remember that Chancellor Zadatny mentioned that there are 15 statewide. All of the associates nursing seats were full this fall, and we have some locations that we struggle to enroll and retain a full class, a full cohort. All of those were full thanks to this scholarship, and we had just tremendous interest. You can also see the associates in early childhood education that jumped by over 130 students this year. Just tremendous interest in these programs, and we were we're very proud of their success and very excited to see this move forward. The state also funded a couple of additional scholarships. There was a Welcome Home scholarship, and that was for Vermonters transferring from out-of-state schools or those who exited during the pandemic and needed an incentive to return and complete their degree. Of the 1,070 transfer students that we brought to the Vermont State Colleges this year, we offered the Welcome Home Scholarship to 278 Vermonters. Did I freeze there, or am I?
Nope, you're
You're
fine.
good.
I froze, so I wanted to make sure you all caught that. And the state also funded a degree completion program, and this was designed for Vermonters who have some college credits but no credential or degree. And it funded up to 30 credits. And again, this was a last dollar program, so that was the cost of 30 credits after state and federal aid. And we had 122 Vermonters that we were able to offer this scholarship to this year. There were a couple of other initiatives that the state funded that are administered by VSAC, and those are the Green Mountain Grad Program, providing courses, free Vermont State Colleges courses to Vermonters in the high school class of 2020 or 2021, and 802 Opportunity, which offers last dollar tuition to Vermonters with a family AGI of $50,000 or less, attending the Community College of Vermont. And so if you look across all of these programs, there's nearly 4,000 Vermonters who benefited from these scholarships and opportunities this year. the quotes on the slides are from our students enrolled in these programs. And I just have to say that they were ecstatic. When we're releasing the financial aid awards and, re-releasing. So we released them in the spring. And then once the state budget was signed a year ago, in June, we released a second round notifying students that they'd received some of these scholarships. And the responses ranged from like, wait, what do you mean my balance went to zero? What do you mean I don't have to take out a student loan? Like, what do you mean my out of pocket is now just so significantly reduced to attend college? I mean, it truly made a difference for our students, and many of them wanted to say thank you, which is what you saw on the slide here, but on their behalf as well, we also want to say thank you for funding all of these initiatives and for thinking of us and our students last year. And Senator Clarkson, that is the material that we had prepared for you. So we'll be very happy to take any questions that.
So it looks like we are not only transforming an institution, we continue to transform lives, which is, of course, what this money is all designed to do. So thank you. Thank you for that initial presentation. I would entertain questions. I see we have one from Senator Lyons.
A quick question about the scholarships that are going forward or grants. And I understand that NVU has a really outstanding master's program for mental health counselors. And are you including any of those folks in the consideration for scholarships, or simply because they're in such great need in the state right now?
Yes. So when the budget passed last year, there was language that said we could allocate to that program in particular. So we actually offer 3 different clinical mental health counseling master's degrees at Northern Vermont University. There was language that said we could allocate to that program if there were funds left over from the undergraduate program. We expended all the funds for the undergraduate program and wrote to the emergency board, I believe around July 15th, saying that we were out of funds, but we would love to fund our remaining students who are on the wait list, as well as the graduate mental health programs. After some conversations with members of the emergency board, both on the legislative and administration side, we were told to fund up to an additional $2.35 million. And so we did fund the students enrolled in that program. The Budget Adjustment Act, I believe, making its way through the Senate.
Out of the Senate.
Out of the Senate. Oh, you're 2 steps ahead of me. The Budget Adjustment Act has that funding set aside to backfill us for the money that we set aside for the graduate students, as well as a second year of funding for the critical occupations program. So if that budget adjustment moves forward, our plan is to fund that program again for next year.
Well, yeah, great. Terrific. I see Senator Hardy has a question.
Thank you, Senator Clarkson, and thank you, Ms. Lavasser and Chancellor Zadny. It's really great to see you both and hear this really good news about the state colleges. It's incredibly welcome after so many years of struggle, and it certainly proves the point that students will go to the state colleges if they have the financial support to do so. But my question is that the Health and Welfare Committee has been talking on and off about workforce issues, and it seems like you are funding and supporting a lot of nursing and childcare programs, and Senator Lyons just asked about mental health. But what I've heard is that there's a shortage of instructors for nursing programs, and I'm wondering, have you felt that, and how are you addressing that, and what could we do to help?
Yes.
Yeah, yes, I would say definitely that's absolutely true. That's one of the things. It's a complex problem. So there are lots of issues around increasing the number of nursing students, but salaries for faculty is definitely one of the key pieces. And again, I'm going to let, now that Catherine's taking a drink, I'll let Catherine talk a little more about that, because we have been really focused on it for the past several months. We've been involved both federally and at the state level in terms of what can we do to help improve the pipeline for nursing students.
So we have nursing programs at both Castleton University and Vermont Tech, and our nursing programs, both because of nursing requirements and because of accreditation, they need to be taught by master's or higher level teachers. And so we need faculty that have PhDs, DNPs, and MSNs in order to be able to teach our courses. With Vermont Tech's program being spread across the state, that's incredibly beneficial to our partners in the hospitals and health system, as well as to the student pipeline, having a course available in your community. It's hard for us sometimes to recruit faculty in some of the remote locations. Salaries are a huge issue. Our faculty units salaries are collectively bargained. A couple of years ago, we were able to get an additional bump for our nursing faculty, recognizing the significant difference in what a faculty salary is and what, for example, a hospital might be able to offer that same qualified nurse. But it is not enough to recruit and retain faculty. Another challenge that we have is faculty retention. And so because we are so squeezed on the faculty end, they're kind of thrown in teaching a full course load, advising a full course load, their first semester ever as a faculty member. And that can be tremendously overwhelming and tremendously challenging. And so we do see a lot of burnout as well. What we're working on right now is we have a cross-institution group that's working on a kind of a comprehensive nursing expansion proposal, but it also includes some thoughts that we have around additional supports for faculty, and that includes adding advising and tutoring staff, which we just currently don't have capacity for, to offset some of that additional assistance that faculty are providing students to help them through their courses, to take off some of the advising responsibility as well. And so we need to address it on a number of fronts. There's the salary complication. There's the challenge getting nurses who are masters and higher qualified to take a faculty role. We don't have enough masters and higher qualified nurses in the state to serve the healthcare system needs and the faculty needs. We did just this fall, we opened the master's program at Castleton, thinking that we could help to address some of our own faculty shortages by having our own program. And we've done kind of a soft rollout of that. We have, I want to say somewhere around 5 students enrolled for the very first year, but we're looking to gear up to cohorts of around 20 or higher. But it's going to take many years to shift the equation there, and would be very happy to visit your committee, to bring in some of our nursing department chairs and deans to talk about it as well, because it's an issue that we feel very acutely.
Yeah, thank you. Do you have just one question? I didn't hear you mention partnerships with other states or other institutions. Are you working with maybe some institutions in other states that might have the ability to meet some of this need in conjunction with you?
I'm not familiar with partnerships with other states. I will say we do, we have some partnerships with different hospitals and health systems. So one model that works decently for us is called a joint appointment. And that's where, let's say a master's qualified nurse might have 25 hours on the floor in her hospital job or his hospital job, and might have 15 hours that they're serving as a faculty member for us. It's a model that is complicated to sort all of the pieces out, but that is the kind of partnership that's worked in a couple of instances where we've had difficulty recruiting like for example, a full-time faculty member.
Okay.
We do have relationships with hospitals as well in terms of clinical placements. And again, we had mentioned we do have some across the border in New Hampshire where at Dartmouth, I forget all of them.
It's like Dartmouth, Keene, Littleton.
And there's another one. But again, a lot of those centers are serving Vermont patients, right? Because they're just right across the border in New Hampshire.
Great. Thank you. Any other questions? I have an upskilling question, and it's at the data collection so that we can measure things going forward. So we created this incredible opportunity for people on unemployment insurance to take these free courses to really upskill. And I've heard from several employers that sadly they lost employees to that, I mean, great, because they've upskilled. Have we tracked them at all? Are we able to really see how we're transforming lives in this and be able to track their salaries before, when they went on UI, and then after these programs? Are we able to, have you built in any tracking so that we can actually celebrate this kind of a model in the future, or and support the work?
In the upskilling initiative, I don't believe there's a UI component to it. They just have to verify with us that their employment or their employability was somehow impacted by the pandemic. And we do that through the onboarding process with the students. The information that we are tracking for them is some demographic information, some career change information. So for example, are you using this course to completely shift careers, to achieve a better paying job, so there's a number of questions in that regard that we're asking.
Good. Because I think that's something that all of us are very, as we look at workforce development and what changes and improves, and we talk about good paying jobs, what's helping pull them into those jobs and enabling that. If there are no other questions, is there any other question?
Can you see me,
I
Allison?
see Senator Starr, and then we'll go
Yeah,
to,
okay.
and then we'll, yeah, Senator Starr.
Yes, I'm wondering, I think we have people from up north going to Linden to do nursing programs online connected to VTC. Is that accurate?
Yes, we have a Linden cohort for our practical nursing and our associates program currently. We actually just announced in November an expansion to that program. And so we're actually converting a whole space on the Linden campus to a simulation lab. So that's like the specialty robotics lab that mimics clinical hours for nursing students, a skills classroom, and a nursing classroom. So that we'll be able to expand our nursing program there by about 60 seats, 30 practical nursing seats and 30 associate seats in the next couple of years. So we have a very small cohort there now that's doing kind of a hybrid access model. And this expansion that we just announced is going to allow us to have a much larger cohort. And it was done in partnership with NVRH, actually. They supplied a lot of the hospital equipment that we needed. But we'll be able to serve a lot more students in the Linden community with this.
Right.
Yeah, that's great. Thank you.
Thank you so much, Sophie and Catherine. Really wonderful to have you. And we're very grateful. Keep up the transformational work. We
Thank
will
you.
do our best to try and keep up with you and keep supporting this work. So thank you very much.
Well, thank you so much. Thank you for inviting us. We really, really appreciate it.
Any day. It was great to have you. I think now we'll turn to action items on the floor of the Senate this week. And I think we have Senator Lyons, who's going to update us on the parent-child bill, which has gone to approps, but will be coming to the floor soon. Senator Lyons.
Thank you, Senator Clarkson. You have a new name. So I'll tee this up, and Senator Hardy is the reporter of the bill, and she can carry forward with any further details. I would like to say that this is a very important bill for all of us. We know that parent-child centers extend across the state and provide 8 core services for kids and families, and including things like home visits or parent education or support groups. And you may be familiar with the Parent-Child Center in your own area. I have 2 in my area. The one that many people might be familiar with is the Lund Family Center and others. So the bill itself is critically important because it really establishes the parent-child centers with specific standards, and it allows for the parent-child center network to be formally connected one to the other. So we will now have some standard criteria for establishing parent-child centers in the future. and for evaluating the services that they offer to throughout the state. The policy part of the bill is, as Senator Clarkson said, hopefully it'll spring out of appropriations. Our committee is very committed to those policy pieces, and I'll let Senator Hardy follow up on that in a minute. The funding piece is pretty large, but we also understand that we're going to have a lot of funding recommendations that come out of health and welfare. And so rather than have the first one be our top priority, we decided as a committee, we will pass these funding bills out, and then we will prioritize as we move into a discussion on the big bill going forward. But that doesn't mean that parent-child centers are not a priority in terms of funding. It simply means that we will look at all of our funding requests holistically. And we didn't want to put the Appropriations Committee on the spot to make those decisions for us. So we will be working collaboratively with them. So I'm going to turn it over to Senator Hardy and let her talk just a bit about S91, the Parent-Child Center bill. And really, I hope that you all will be able to support the bill as we go forward and it comes out onto the floor.
Thanks, Senator Lyons. Senator Lyons covered most everything that's in the bill. It's not a very long bill, but it does codify and formalize a lot of the procedures and processes that are already happening with parent-child centers in terms of their oversight and their standards and review process. And it empowers the network to really be sort of peer evaluators of each other and making sure that all of them are supported and meeting their own standards in conjunction with the Agency of Human Services and providing the services to families in all of our districts. There are 15 of them across the state, and they cover the entire state. So we all have parent-child centers that serve our constituents, and they are an incredible resource. And I can provide more details, and will certainly do so on the floor, but happy to answer questions if anyone has them.
Great. Any questions for Senator Hardy or Lyons?
Thanks.
Right. Then thank you. I think then we're done unless anyone has something else they need to discuss at the moment. We have 4 minutes, I think. So if we have 6 minutes. So if anybody has anything, otherwise we'll give you 6 minutes to go and actually stretch your legs before our afternoon committees. Any other business we need to discuss right now? Great. Then we will see each other in afternoon.